everybody. I wanted to thank Tim and the organizing committee for inviting me as a health professional into a group of workers who are interested in forest fire. And you may wonder how this relates, but I'm hoping I'm going to bring you around a little bit to understanding some of the work that we've done during the pandemic and continue might apply to the forest fire industry. This picture is myself and my engineering partner, Dr. Ravi Salganapi. And at the beginning of the pandemic, I asked my colleagues on engineering, we don't have enough masks. And this led to the development for the Center of Excellence in Personal Protective Equipment and Materials. And so, as I said, this started in the pandemic, and I don't necessarily need to remind this audience, but it was a big problem with lots of cases, lots of deaths in Canada, and a lot of associated healthcare risks. And you can imagine for those of us who were working at the beginning of the pandemic without very little protection other than the N95 masks that we wore to protect us. And at one point, I recall that the outbreaks within healthcare workers was absolutely extreme because we'd wear our masks when we were working with the patients, and then we go into break rooms, and even that 2-meter distance was sometimes not adequate for, depending on the ventilation in the room that they happen to be in. And so the transmission of COVID is particularly important because not only does it have some direct contact, but there is some aerosolization of particles, and they certainly, as we've learned with the smoke and everything else, can pass through different materials. But the other thing that we need to think about is in the healthcare industry, the majority of our healthcare workers are in fact women. And most ethic groups, in fact, the Canadian standards and the NIOSH standards that we've developed don't meet the standards for a well-fitting PPE, particularly an N95 respirator. And not all face and head shapes are the same. I've just given you a couple of examples here, but you can see that there are a number of face shapes. And particularly, highlight the anatomy of the nose. You just palpate your nose. Most women have a very flat nose. Most men have a bit of a little lip on the bridge of their nose. I happen to have a bit of a bridge on mine, but ethnic background also makes an impact on the shape of that nose as well. And if you look at measurements, they rarely take into account. So I can recall many colleagues where the mask was even a nice bridge on an N95 was slipping off their nose. And so we designed this study to particularly look at the quantitative fit test of N95, do a little bit of a qualitative survey, and particularly doing this of healthcare workers. Now, we did this in the middle of the peaks of the pandemic, and my poor graduate student, we were trying to recruit. So what I'm going to show you today is very preliminary data. So even though we had plans to recruit 100 participants, often the grad student ended up just helping in the fit testing clinic to get the lineup of healthcare workers that was in and around out the door that had to get through the study. And we did the traditional bizygomatic method of the breadth across the nose and the Mellon-Sullivan length, and were mapped onto the NIOSH bivariate panel and a range of widths. We did the quantitative fit test, and you've already seen with that head form, the twists and the turns that we all do, but we particularly wanted to get some fit factor data back, so we used quantitative and not the qualitative analysis for this, okay? And a minimum fit factor of 100 to pass. This table really illustrates, and you can see we purposely selected a larger number of women than men that came through the door. We separated versus white versus non-white. And you can see, although it's preliminary data, there's a general trend towards fit factors that are better in the men than compared to women, Mellon-Sullivan lengths that are slightly shorter and bizygomatic. And so a significant difference in the mean fit factor between men and women in this case. And this was preliminary data only on the NIOSH bivariant panel, showing that 75% of the healthcare workers did not fit into the bivariant panel. So every little dip is each a different healthcare worker. The red dots are the women. They didn't fit into the panel. So what about the firefighter industry? So I did a little bit of looking, and it depends. This is Canadian 2019 data, if I remember correctly. Management, operational support firefighters, yes, by bar, the most people into the firefighting, as we've seen in some other figures from other speakers, are by far more men. But you can see in the operational and support staff that may still be in contact with smoke in the area, there's a significant proportion of women in that area as well. What about the qualitative work? And this we asked about physical discomfort, pain and pressure. So similar to some of the literature that you've been discussing about the length and time and trying to convince these seasonal staff to wear even an N95 mask, we had to wear this for hours of the day. So in and out, hot situations, lots of PPE on, similar situations. And in general, there was a difference between the breathability and the comfort for men versus women in terms of the fit factor. Again, very preliminary data, maybe some difference between ethnicity as well. And we took some quotes from these people in terms of unclear whether they were going to wear the mask and be in pain by living it. And we did a lot of manipulation. There were a lot of people who put clips on the back of their heads to not have the same pressure in terms of the back of their head. And as you know, the standard is not to have ear loops, it's to have the back of the head. So head shape was important. There is some other literature to support some of the work that we've been doing in terms of that came out, some of it in the early pandemic in terms of fit factor failure, difference in fit between men and women, and difference in terms of ethnic background, white versus non-white as well. So what are the chronic health issues that are associated? Well, there's been two great presentations about some of the chronic health issues associated with wildfire smoke, but when they get to me in the hospital, here's what I'm worried about. I'm worried about worsening asthma and worsening chronic lung disease from this exposure, and 26 days may be insufficient to see whether the long-term complications. We've talked about airway, and we've talked, and here women, seniors, and children and Indigenous populations are often at the greatest risk for these airway disease out the other end. And the Government of Canada and the Health Canada website actually says where you're in N95 respirator if you're in the smoke, but we haven't done a great, I don't think, advertising with all of the wildfires going on across the country right now of advertising or providing N95 respirators. So where are we at right now? Preliminary data done in the middle of a pandemic, challenging to do. We're in the midst of trying to repeat this study with a larger population. In the meantime, ISO has come out with this lovely complex PCA analysis that they say 95% of the people that they tested of both sexes would fit into this PCA analysis. I'm going to suggest you that diversity matters, ethnic, face shape, gender, sex and gender. New standards in Canada, one of the challenges that we've had in Canada is, CSA and NIOSH standards. We've had to go to Canadian Standards Association to get some of these masks across. The impact on healthcare workers and those living in fire zones. And it really is unclear whether this PCA will fit. I'm not sure that we can solely go with a two-dimensional analysis, and that we might in fact need a three-dimensional analysis. And with that, I'm going to conclude and thank Fatima Sheikh was the graduate student working on all of this work in the middle of the pandemic. Certainly the support from CPUM and McMaster And there's my email address if anybody wants to have a